Black History Month is a time to honor the strength and resilience of the Black community, and that includes prioritizing mental health. Studies show Black Americans are less likely to receive mental health treatment despite experiencing conditions like depression and PTSD at similar or higher rates. Joining us this morning is psychotherapist Dr. Nanette Funderburk to talk about why these disparities exist and how we can break the stigma. Good morning, Dr. Funderburk. Thanks so much for joining us this morning.
Good morning, and thank you.
My first question is, why is it especially important to talk about mental health during Black History Month? And how does history still impact mental health in the Black community today?
hmm It's important to talk about it 365 days of the year, especially during this time where we're highlighting so many of the great things accomplished by our community. Education and conversation about just what mental health is and how therapy works. This starts to break some of those long-held stigmas. Our community absolutely remembers the experiments done by Tuskegee, Henrietta Lacks' story, and other situations exactly like that that were deadly to our populations. And we have not forgotten them. And we, the thought is that I don't know, should I do this or should I not? Because I remember so and so told me the story about X. And we continue to pass some of that along. So the conversation about it is absolutely important.
This brings me to my next question. So mental health, it has historically been a sensitive topic in many communities, but why does a stigma still exist in the Black community, and how does it prevent people from seeking that help?
The stigma still exists because the stories that have been passed down were not just stories. They absolutely happened, and there were people who literally lost their lives, or there were people who had their DNA, their biology, parts of it were taken and used to figure out how to make other people better, while we were the test subjects. We were the ones who were left feeling ill, feeling sick, and literally dying while some of these things were happening. So yes, those stories are absolutely still in our community. We remember them, we discuss them, and we need to be able to pull in discussions about others, and how healthcare can work for us so that we can move forward in our own positive health journeys. But those things haven't been forgotten, and that's why I believe that it can be difficult for us to address mental health.
So this next question is kind of a two-parter. We know many Black Americans are less likely to receive mental health treatment. What barriers are contributing to that? And secondly, why is it important for patients to see, or how is it important for patients to see culturally competent therapists who understand their experiences?
Right. Okay. So some of those barriers are easily some of the barriers that you see for marginalized communities. There just may not be access in ways that are easy for the community, or specifically our community. There can be financial barriers. There can be some may have connected with providers in the past and felt dismissed or felt unheard. And once you feel that, it is very hard to get rid of that. Also, other barriers like where are the providers? Are they in areas that our community can access, can reach? So again, we're talking about access to these providers and to the services that are out there. Now, say your second question for me again.
My second question was, how is it important to see for patients to see culturally competent therapists, like therapists who understand their experience?
Right, because culture is a thing simply because we are different. Our community is different from other ethnic communities out there. So it's important to know that what may mean one thing in one culture, could mean something very different in another culture. And so just because someone may be very talkative, or just because someone may have given their game face day, the name that they give for themselves on a game face day, might be that thing that it gives them the impetus to move forward on a particular day. But that doesn't mean that they have multiple personalities. It just means, okay, today while I'm trying to get myself going, I'm calling myself by this other name that makes me feel great. It doesn't mean that that I have a severe and persistent mental health issue. Those things like that can get misconstrued, and we can start to think that there are disorders there that are not there. And so that can be how culture kind of gets twisted in a way that it was never meant to be. It's simply a misunderstanding. So it's either you want to have somebody who's in the culture, or you want to have someone who knows about the culture or is willing to learn about the culture.
And what are some warning signs that someone may be struggling with their mental health, and when should someone consider reaching out for professional help?
You want to look for changes. So I always think about, know what your baseline is. You know how you normally move. You know how that friend of yours, that loved one of yours normally moves from day to day. So if they are normally, fairly talkative, they come in and they say, XYZ to you. They say hello, they say the normal things, but on a different day they come in and they just kind of go straight to the room, or they just kind of go straight to the kitchen and get a snack and then they leave. When those baseline things start to shift, that's when you can recognize, okay, something's a little different here, and we need to make sure that we're just checking in, because it could just be a bad day. And if it's a bad day, that's okay, it's a bad day. But if it's more than a bad day, if those baseline behaviors continue to be different, then that's when we want to say, okay, let me check and see here what might be going on. So when do we seek help? We start to seek help just like you do with your physicians. You will start to say, you know what, if I have a cold, I might not go to my doctor right off. I might say, well, let me go get some over-the-counter medicine. Let me see what I can do myself. Let me check in with a friend to see what they did when they had XYZ situations going on. And when you do those things and they don't work, that's when you say, oh, I think I need to make an appointment with my physician. It's the same thing in mental health. When you start to do the things that you think will work, or you do the things that have worked in the past and they don't work, that's when you start to seek out a professional.
Dr. Funderburk, very quickly before we wrap and head to break, what steps can individuals, families, and communities take to break the stigma and prioritize mental health?
Yeah, we want to talk about it. Have those conversations. If you are going to therapy, let someone know. Even if you have to start with just a very close person that you know, whether that's a friend, whether that's a close family member, just let someone know, you know what, I went to therapy today and I actually feel better after just going and kind of dumping all of my stuff in a non-judgmental space. So let somebody know. Also recognize that you can really actually receive benefit from going to therapy, and from using any of those medications that a psychiatrist might prescribe, or the medications that a primary care physician might prescribe for psychiatric situations. And when you start to feel better, when you start to have a little bit more clarity of thought, when you have more energy, when you have more calm, depending on which one is needed, then you start to move better in your family unit. You start to move better in your community. And you're actually giving back and doing the day-to-day things that you were here to do in the first place.
All right. Well, thank you so much for joining us bright and early and to discuss such an important topic. We'll have all of these details up on our website.